you're welcome. I'm Dr. Soyemi Damilare, a senior registrar at the Family Medicine Department of Lagos State University Teaching Hospital. On this day, we mark World Liver Day, and I want to let you know that your liver is one of the very vital organs in your body, in my body, and we need to take care of our liver like every other organ. So I want you to note this. One, that there are different causes of liver disease, and this may include intake of non-steroidal anti-inflammatory drugs, especially when not prescribed by your doctor. And if you use this without caution, this may put some pressure on your liver. Actually, we call it toxic effects on your liver, and that may damage the liver. So you need to watch. You don't just take medications or drugs unprescribed. The next thing I will talk about is alcohol intake. Alcohol effect can be on not just the liver, can be on the kidneys, even the heart. It can be on other organs in the body. But on the liver, alcohol has so much effect because the liver helps in processing some of the contents of alcohol. And so when you take a lot of alcohol, you will be overworking your liver. So watch, reduce alcohol intake, and if possible, you may need to stop alcohol intake, and then follow your doctor's recommendation on this. The next thing I will be talking about is check your viral hepatitis status. Hepatitis B has been identified as a common cause of infection of the liver. It causes damage to the liver, and you need to know your hepatitis status by checking it through a blood test. So get to know so that if you need to be vaccinated, if you do not have the hepatitis virus, you can be vaccinated and to protect yourself. But if you are hepatitis positive, you can also be further evaluated and have some form of treatment. So hepatitis also affects the liver. Lastly, I will be talking about the use of herbal concoctions, especially in our environment. Talking about the Nigerian environment, a lot of people consume by the side concoctions. Sometimes you can't really see what have been put together into this bottle or sachet, and some of these actually contain alcohol, which are toxic. They have toxic effects on the liver. So what do you do? Take note of all that I mentioned and take necessary steps. Very importantly, if you have some symptoms like yellowness of your eyes, like pain in your abdomen, these are likely related, they may be related to the liver disease. So you may need to see a doctor to put in your complaint, to lay your complaint, and you will have a proper examination done. Relevant investigations can also be done to identify a person with liver disease. So on this day, take action, protect your liver. Bye.